So best practice is to use a PRP or a second generation PRP called PRF that has no anticoagulant, and that gets activated endogenously when it meets collagen fibers. And then more or less 300 growth factors are getting released. The 7 most important growth factors are listed in this table here on the right side. And they mediate processes such as proliferation of cells, chemotaxis, differentiation, and angiogenesis, and moreover, collagen synthesis, formation of extracellular matrix, and tissue regeneration. Of course, dosing always matters in medicine. Have a look on drugs, and you will always find a specific dose for an indication. And the same holds true with second generation PRP or fluid PRF. If you have a look there, you can see that the maximum proliferation rate for human fibroblast stimulation was achieved at a concentration 2 or 4-fold over baseline, or like this study says, 2.5 times over baseline. So somewhere around 2.5 or 3 times or up to 4 times. This is the perfect concentration. This means you can do underdosing, but you can also do overdosing. It really depends where you inject your PRP or PRF. Besides platelet concentration, it's important to have a PRF that is free of neutrophils or almost free, and that is almost free of red blood cells, because these blood cells cause negative effects. Red blood cells, well, first of all, if you're injecting, your patient is getting black and blue, they're bruising. So we do not like to have them for skin applications. But they also release reactive oxygen species at their degradation, and that can induce inflammation and cell death. So it's a good reason to have a fluid PRF or a second generation PRP that is clear, that is yellowish and not reddish. And moreover, as I said, it's good to have a PRP or PRF that is free of neutrophils. It's important. White blood cells in general are not the big problem, but the neutrophils are a subfraction, and they cause detrimental effects as they release and activate unspecific proteases and toxic substances. Moreover, it's important that the fluid PRF contains fibrinogen. Fibrinogen is an acute phase protein that is very important for healing. So the composition of your second generation PRP or fluid PRF really matters. Have a look on this study, and you can see that conventional first generation PRP is good. So it increased the migration of skin fibroblasts by 200%. That's good. But the fluid PRF, the second generation, is even better. 350% versus 200% increase, that makes a difference. And you can see this clearly if you have a look here on this migration assay. And also, if you have a look on this immunofluorescent collagen type 1 staining, you see that fluid PRF outperforms conventional PRP.